Hello, this is Dr. David Green, CEO of the 2NJ-PAIN Network. Today's topic is the 5 things to ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed annually in the U.S. This number continues to rise. Half overall will not obtain the desired outcome, and unfortunately 10% end up worse than they were before the surgery. The first consideration is whether or not to seek a second opinion. A second set of eyes may be indicated since it is a very big decision. That person may recommend the same surgery, a different surgery, or he or she may recommend no surgery at all. If you have a condition in your low back, you talk to 10 different board-certified spine surgeons, you'll probably get 5 different answers of what should be done. So a second opinion may be indicated. The second consideration is, have you really tried all conservative options first before deciding on surgery? This may include physical therapy, chiropractic, spinal decompression therapy, acupuncture, medication management, and interventional treatments such as what you see here, radiofrequency ablation. You really want to be able to look at yourself in the mirror if something were to go wrong during, or after surgery, and be able to say, you know what, I tried everything. There was nothing left. A third consideration is to really put together a risk-benefit assessment. No spine surgery is risk-free. The adult scoliosis procedures, for instance, have over a 50% complication rate. Any surgery may entail infection, bleeding, nerve injury, anesthesia risk, failure to fuse, scar tissue formation. So these things need to be taken into consideration. Okay? No surgery is risk-free, and no outcome is always, you're not always going to have a home run. The fourth consideration is to really do a reality check on the potential outcomes. We know that half of back surgeries do not end up with a great outcome, and 10% end up worse. So think about this. If half of your pain were to go away with the surgery, would that be good enough? What about 30%? Okay? What about that? You have to really think about how hard it is to get a home run with spine surgery. So here's an example. The FDA study on lumbar artificial disc that was done over 10 years ago, they compared that to spinal fusion. It's supposed to be so much better, right? Well, they didn't really show superiority. They just showed equivalency, about the same. But what they found is that over half of the patients in both groups, at a year after either surgery, were still taking narcotics. All right? So they still had pain. So they got rid of a certain amount of their pain, but they were still on narcotics. Is that going to be an acceptable outcome for you? And the final consideration is to consider the timing of surgery. For elective surgeries, you can pick which time is best for you. Is it a summer break? Is it a sabbatical? Rehab considerations, for a laminectomy, you're looking at about 6 to 8 weeks. For a spinal fusion, about 3 months. And for adult scoliosis, anywhere from 6 to 9 to even 12 months. Okay? So think about that. What's the best time to undergo the procedure? The bottom line is you want to feel comfortable with your decision, because if the surgery does not produce the desired outcome, you still have to look at yourself in the mirror, like I said. It's reasonable to work through these 5 considerations to make sure that undergoing back surgery is the right thing for you. The top pain management in New Jersey is through the 2NJ-PAIN Network. There are several clinics throughout the state accepting over 50 insurance plans and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us at 844-2NJ-PAIN. Thank you very much. I'm Dr. David Green with the 2NJ-PAIN Network. Your pain stops here.